Welcome and thank you for joining us today. In this session, we'll begin with a presentation by Sweta Neygandhi on how to find a mental health provider, followed by a Q&A discussion with Gina Park from AAPI New Jersey about community-specific needs. Sweta, I'll now hand it over to you. Thank you.
Hello, everyone, and welcome to How to Find a Mental Health Provider. My name is Sweta Neygandhi, founder and clinical director of Therapy Story. This webinar is sponsored by AAPI New Jersey, and we are excited to help increase access to mental health in the AAPI communities. Our intention as we get to meet with you today is to make it easier for you and others in the AAPI community to find a provider who truly understands your needs. At Therapy Story, the business I founded, we call it feeling seen, felt, and heard. What do we hope you achieve today while getting to be here with us? We hope that you're able to learn simple, clear steps to connect with the right provider and to share resources designed to support the unique experiences of the AAPI community. To begin, as we often need to do and want to do, we'd like to start with the grounding exercise. What is grounding? It's allowing you to stop what you're doing, really come into the space that you're in right now, wherever you're sitting, wherever you're listening. Feel the ground underneath you. Feel the chair or the couch that you might be sitting on, wherever you might be standing. And allow yourself to be there in this moment. Take in the scenery. Allow yourself to smell what's around you. Hear the sounds that you can hear. Taste what you tasted last in your mouth and really give yourself the opportunity to show up and be here as you chose to listen to the resources available to you. With that, I'm going to take a deep breath in and a deep breath out and guide you on the questions you may have. Before we dive into the how, I want to take a moment to share a little bit about myself and why this topic is so meaningful to me, both professionally as a therapist and personally. I think it's important to know who's talking to you and what's bringing me to this work. As a mental health provider, a mom, partner, a sister, a daughter, I often recognize that so many people will come to me and say, I just don't know where to start. How do I even begin to ask the right questions? Who do I call? When do I find time? How much is it going to cost? And when I recognize not everyone has a therapist to go ask a question to, I thought, where are all the people who don't have someone to tap into going? Who are they asking? Where are they gaining their information? And while we have online resources, we have ChatGPT, we have so many different avenues now, we don't always have ones that are talking directly to us. And that's what matters is really feeling that moment of did you feel seen? Did you feel heard? And hopefully, you feel like you got your next step. And so, in allowing this opportunity with AAPI New Jersey, it really gives everyone access to speak to someone that otherwise maybe they didn't know if they could. So, my hope today is that you feel like you got the information you came here looking for, that maybe some of the you didn't know what you didn't know areas got answered. And then if you have more questions, you know that AAPI New Jersey is here, ready to listen, ready to support, and ready to guide you to your next step. This conversation today, it's about all of us. It's about the bigger picture of what's happening in our communities. The reality is, even though 15% of AAPI population will report struggling with mental health in the past year, we are the racial group least likely to seek services. Just by attending this workshop, we're helping fight stigma and build knowledge that you could help yourself, a loved one, colleague, a neighbor. You're creating opportunity to be a bridge to a greater conversation. You're acknowledging that what we feel, what we hold, what we experience, it matters. And we need to be able to talk about it. We need to be able to listen and understand that not everything you've experienced has to be something that you don't pay attention to. Just by attending this workshop, you are helping fight stigma, building knowledge that could help you or a loved one. You're allowing yourself to show up today and recognize that by being here, by gaining knowledge, by gaining information, you could be a bridge to more resources for those in your community. By gaining knowledge, by allowing this to be important to you, you are making it important to those around you. And it matters. Our peers listen, our partners listen, our children listen, and we model what we learn through behavior, through interactions, through choices we make. And so it matters to acknowledge that our mental health is important. It's a large part of how we relationally connect, where we might create roadblocks. When we don't know what we don't know, we're not always able to know where to go next. So you are changing that by being here today and allowing yourself to listen, to learn, and to hopefully apply the tools that you'll get through this workshop today. What is therapy? Isn't that a great question to start with? Therapy is meant to really be a place that's structured. It allows for reflection, professional support. Your therapist is listening, they're understanding, they're allowing themselves to best assess your previous experiences, current experiences, and what opportunity you may have in the future. I'll often hear, I don't need to see anyone. I know my concerns already, and I have a great support system. And yes, friends and family, they are important. They'll listen, they'll even give you advice, but advice doesn't always meet you where you are. Often, advice is given because of an experience someone else had, and they believe that their experience and what they did or didn't do may have the opportunity to guide you in what you can do. It's well meaning. Sometimes you may even get a moment of, I might do some of that. However, the reality is it doesn't take into account who you are as an individual. It doesn't take into account what you've experienced, where you're going, your day to day experiences, how you've processed them, how you understand them, and the choices you may make today and the choices you may make in the future. Therapy is just different. It's a process. A therapist creates a reflective space where you can sit with what's coming up, sometimes even things you don't even have words for yet. Just being in that space can bring relief. Often I'll hear, I felt relief from the time that I called you to make this appointment to the time that I've come in. I like to call that space in between the first call and the first appointment hope. It's ingrained in the root of our work. It's hope that what I feel today, I don't have to feel tomorrow. It's hope that the things that I've been doing aren't working for me. Someone else is going to hold a mirror up to and help me understand. And they're going to be gentle, but they're going to be intentional with me. Not only is the therapist going to notice it, but their intention is to also offer a roadmap on how to move forward. Not only does the therapist meet you where you are, they're already considering where you can go. And that relief you feel, that hope that it started with, what you receive in the room is that experience of being heard, being validated, and being guided. And yes, the therapist is always applying their clinical capabilities. They're always considering how to use them. And the longer you do this work, the reality is the more tools you have, and most likely you couldn't tell somebody what ingredients are in that pot, but you know why you're using them. You know that they have opportunity to create change. and you know that they were individualized for the person or the people sitting in front of you. There is not a one size fits all approach in therapy. And therapy for the AAPI community, it comes with additional awareness for what experiences often come up in the community, in the home, generational traumas, awarenesses of what it was to immigrate from another country, learn a new language. We get specific, we name things, we help you formulate words and sentences in ways you did not know you were doing in the past. Because we thread together the story you come in with and we help you navigate it and narrate it together. All that while creating change, opportunity, and relief. In the AAPI community, we know that seeking therapy is often discouraged due to stigma. Many of us don't grow up hearing, maybe you should talk to someone. Often the message you may hear is be strong, keep things in the family, don't make a big deal out of it. Therapy provides support both for the person who may be in struggle and for their loved ones. Seeking therapy is strength, not weakness. Fear of judgment or burdening others that you may hear about if you are to share is the exact opposite of what occurs in therapy. In therapy, there is no judgment and there is no burden. There's a choice being made to allow what you've experienced to be real, to allow what you've experienced to be named, to acknowledge that there's an impact on you and those around you, and that you made a lot of choices based on what you've been told rather than what you've asked yourself. Our intention in AAPI New Jersey is to help you recognize that we can remove that stigma when we start to allow our mental health to matter. When we start to be able to say that how I feel, it does drive my choices. It does drive what I want to do. It does drive where I may go next. And I want those things to be considered. And I want to hear my own voice along the way and not just the ones that came before me. We value everything that the culture has to offer while understanding that not everything needs to come along in the future. It's often one of the biggest struggles in the AAPI community. If I allow myself to be heard, am I abandoning what I've come from? And as a therapist who's also part of the AAPI community, I encourage everyone to consider that when you do this work for yourself, you are really doing this work for a larger whole. And you're offering something to your community that otherwise may not have been there. Finding a provider. Ugh, how do I do it? Where do I do it? How does this really work? Is it like making a doctor's appointment? Is it like picking something or someone that I just don't know and I have to figure out if I'm going to like them based on a profile online? Yeah, there's a lot of questions right there when we think about our practical steps to find a provider. Of course, we've just spoken about the layers and layers of why our community may not know where to start and may need a voice to guide them. I'm here to help you understand what it means to start looking for a provider. How do you do it? What's the first step? As a provider, I acknowledge therapy should not be a new stressor in your life. You are here because there's a possibility that you or someone in your life may need support. And you want to know where to start. We've talked a bit about stigma, therapy versus advice, why our community may be hesitant to seek out services. Now we need to talk about how do I start? First step is, do I want to use my insurance or am I willing to go out of network? What is in network versus out of network? In network, just like any physicians you may see for preventative medical health, means that you see someone who takes your insurance. So it's a therapist who is paneled with that insurance plan. You can search your insurance website or Psychology Today and filter by insurance, specialties, location, or telehealth. Out of network services means that the therapist doesn't take your insurance directly. They are going to provide you a super bill, which you are going to submit for reimbursement. Many clients do get 50 to 70% back. However, you will often pay your therapist or your practice that you are a part of upfront, and you will wait for reimbursement from your insurance company. Now, all insurance companies do not necessarily offer out of network benefits. However, many do, and they're often underutilized. At the end of this webinar, you are going to get resources. One of them will be an out of network guide. What do I call my insurance company and ask? How will I understand my out of network benefits? How will I know what my reimbursement looks like? And how do I submit for them? All of those questions will be answered in our out of network guide. Encourage you to recognize that while an in network and an out of network therapist all have great capabilities, great strengths, great clinical skills, there will be more options in an out of network service. And why is that? Because many providers do not get paneled. And therefore, you will have access to more providers if you're willing to go out of network. So the cost does look different. You may learn that your out of network benefits are able to reimburse you at 50 to 70%. However, you may have to wait for that 50 to 70% to return to you. And that is a personal decision on whether or not you are able to do that. They are both out there, they are both available to you. And being informed is the first step in getting the services that you may need for yourself. The super bill, what goes on there? Your name, your identification information that we have on file, your clinician's name and their licensure, a diagnosis that's billable that also meets criteria for you, and the code for the service that they provided. Was it a 45-minute session? Was it a 60-minute session? Was it a family session? Codes will also be available on our out of network guide for you to ask your insurance company if they are covered or not in your out of network services. What is this going to cost me? Now, an in network copay is based on your insurance plan. In our experience, in speaking to our community members, the average copays we're seeing are $20 to $50 out of pocket. So, what does that mean? Your therapist will charge that at time of session, and your insurance company will have negotiated a rate with your therapist, and they will get the rest of that rate from the insurance company directly, and you do not have a role in the billing process. Out of network sessions close to our area in northern New Jersey, and of course, it is absolutely going to be based on where you are located. It does impact pricing. Sessions that we're seeing for individual rates are often $175 to $295 a session. And the rates that we're often seeing for couples are anywhere from $250 to $350. Psychiatry evals, and a reminder with psychiatry, that's medication management and assessment. We're seeing in an out of network service is anywhere from a $500 to a $700 assessment. Those are usually 60 to 90 minutes and $400 for follow ups. The psychiatrists that we've had the opportunity to work closely with have often informed us that they will do an initial assessment. They will typically do a follow up appointment with their new patients within 3 weeks to see how that medication has been. They may do anywhere from 1 to 3 follow up sessions based on the medication if it is a good fit. And then from there, the appointments will become much more sporadic. If the medication for any reason isn't a good fit, those appointments will definitely increase until a medication that feels as though it has stabilized the patient is provided. There are in network psychiatrists available. The wait list, similar to an in network therapist, may be longer, but they are absolutely out there. Similar to looking for a therapist on your insurance plan or Psychology Today, you can look for the same services for a psychiatrist as well. How do I decide who I want to work with? Identity. Do I want to work with someone who shares my same background? Is that important to me? Race, ethnicity, cultural understandings, cultural values being understood in the room without having to explain them. That could be important to you. Maybe just a face that feels familiar will create ease. There is no wrong answer. What I encourage you to do is ask yourself the question: do I prefer a provider who shares my background? Do I require a provider who shares my background? Knowing that is going to allow you to hone in on who you may want to work with. If that preference does not feel like a must, then it may be that cultural competency is the most important part for me. What is cultural competency? The therapist that I am choosing to work with has an understanding of the community and the culture that I am a part of, that they have chosen to do the work to try to understand the thread, what it means for me to have the identity that I do. The other part is that they're allowing me to also name what my story in that identity is. There is no right or wrong. There is what's right for you. Some people may say, I don't want an AAPI provider because I don't want them to make assumptions that I've had the same experience as them. And someone else may say, I don't want to walk in the room and have to explain anything. And therefore, I do want an AAPI provider. You get to decide. We get to meet you in your decision. Gender. Is that important to me? Is it important to me, the gender of the therapist I work with? It's a personal preference. Your comfort, your ease, your ability to trust is what we encourage you to use when you pick who you're working with. Language absolutely matters. We want to ensure that the language in which you feel you can most express yourself in is ideally a language your therapist can speak with you. That is the hope and the intention because we want you to be able to share what your first thought is. Age and religion, for some, it may feel important. I would encourage you to ask yourself what is important about it. There are some therapists who will specialize in certain communities. There are some therapists who will have a specialty based on religion. And what they're telling you is that that is a guiding value in their room. And if that feels important to you, absolutely go in that direction. If it feels like it's a part of you, but it's not the part that's leading in the room, it sounds like you may not need to prioritize that. As a therapist myself, it's rare I share and talk about my own religion in the room. While it's a part of me, it doesn't guide the work that I do. It's most important that I meet the client where they are and understand how religion guides the work we are doing together. Specialties. We come to therapy for different reasons at different times. Sometimes we come because we know we just need a place to land. We know we have things to work on, but we don't really know what they are. And in that scenario, you may need somebody who has understandings of anxiety and depression like all therapists will. And that may be enough. And if that is your starting point, you have a ton of options because every therapist can meet you in that space and understanding. However, if you're coming to therapy for something specific, a few I will name is a trauma that occurred, perinatal work, couples, kids, adolescents. If you know that something like CBT is great for you, and what is CBT? Cognitive behavioral therapy. An evidence based model, it'll give you automatic tools on how to use it in the work. You go home with homework and you know that that speaks to you, you'll choose it. Psychodynamic, it's a more open space. I'm willing to look under the rocks and I'm willing to see what was there. And I'm also willing to understand how it's helped you form who you are today. Solution focused. Give me something that is focused on the next 12 weeks. Help me get from start to end and know that I can walk around with this tool in my tool belt. Gottman, EFT, both famous couples therapist models. There's choices out there. When you make that first call, which we'll talk about later, the therapist will help you understand what are the differences in what I'm looking for? What is it that I've called about today? And where is it that I may be starting in this work? It is absolutely okay to ask your therapist what approach they use, what that means, and how it could look in sessions. While you don't need to know every model, it's okay to understand what the steps may look like so that you can receive the care that you are looking for. There are absolutely people who may call and say, I don't want that psychodynamic model. I don't want it to just kind of be meet me where I am today. I want you to get me a bit more focused. I want you to build that roadmap for me. And if that's the case, it's the therapist's work to name what that is, ensure that if they're not the best fit for that, that they can try to help create a bridge to those who may be you closer to getting in that therapy room and getting your work started. There's multiple formats available to therapy now. Before the pandemic, telehealth was available. It was used a bit less unless you were in a more rural area. However, now we're recognizing we're enjoying the benefits of telehealth. We like the flexibility. We like the access to more providers statewide. We like knowing that I don't have to be 10 minutes from your office to be able to see the person I want to see. At the same time, some people say they prefer in person sessions. They want that face to face connection, or that their home environment just isn't private enough for them to drop into the spaces they need to go. In person work has the opportunity to be a bit more contained. And for some, telehealth offers convenience and flexibility. These are all personal to you and what you need. If the therapist is finding for any reason that either the in person or the telehealth doesn't seem to be providing you what you clinically need, they'll break it up. They'll let you know and they'll help you assess how to make it a better fit for you. But again, they are here to guide. Your only work is to know where you'd like to start. First intro call. It can be hard. If you've never made that first call, there's no doubt there may be some nerves going into it. But it's that therapist's work to create ease on that call. Most therapists will offer a free 15 to 20-minute introductory call. That's your chance to get a sense of whether you'd feel comfortable with them and whether or not they could be a good fit for you. It's not a therapy session, but it is a conversation. You're able to share briefly what you're looking for. You can ask them a bit about their style and training if you feel like that's important to you, or what a first session might even look like. Could be a great time to ask them about their beliefs or training around cultural competency, and that will help you understand how they're able to listen to your needs. Your intention in that call is to say, did I feel safe? Did I feel like their approach could meet me where I am? Ask everyone to consider, how did you feel when you hung up? What did you notice in your body? Because that call was the first step to being able to consider if that's someone that I can see myself sharing with, meeting with, allowing myself to be seen by. How often will I be in therapy? During the first call, the therapist will usually give you a little bit about their background if it feels relevant to what you may be asking about, and the type of clients they typically work with if they have a specialty. They may even share a little bit about their approach and what that could look like in sessions. They'll let you know about logistics, how long sessions are, what their fee structure is, if they take insurance or provide super bills, and whether or not they provide in person, telehealth, or both. The goal for the therapist is to give you enough information so you can decide if it feels like a good fit to book a full session and to ensure that what you called for recognized, heard, and ideally seen. If you were able to feel relaxed, safe, and understood, your only next step is to trust your own instinct. That connection call, that rapport that you're building, it's the first step. Tips and resources. Go back to our earlier information. Where do I even start looking? I usually continue to recommend a few places. Psychology Today continues to be the most popular directory. Therapists will fill out a profile, they'll write their own, they'll share a little bit of information about where they're located, what their specialties are, what their fee structure could look like. And it'll give you some guiding information on whether or not that may be someone you could start with. ZocDoc also has a range of therapists on it. It'll give you the opportunity to know if you can schedule with them right away, and it usually even gives you a booking link to book with them immediately. Your insurance company's website usually has a provider directory. However, that can be a little harder to navigate. We also find community resources, Facebook groups, local word of mouth organizations like AAPI in New Jersey that keep a list of trusted providers can be really helpful too. Want to remind you, it's normal to reach out to a few therapists before you find someone who's the right fit. Even making that first call often brings that sense of relief because you're taking a step forward. It's okay if after the first consultation call or even after the first few sessions you realize they're not the right fit. It's normal. Sometimes it takes talking to two or three people before you find the one you click with. Encourage you to recognize you can find people to work with that are going to be a good enough fit for you. Starting the process is the first step to change. As we leave today, just want to remind everyone that therapy remains a supportive tool for individuals and family. Cultural stigma is real, but seeking help is powerful and it's a change agent. Thank you for being here today. Thank you for choosing to make this important. And we hope that you'll be able to use this information going forward and you'll receive the resources you need to get started. Thank you.
Thank you, Sweta, for that wonderful presentation. You shared so many practical tips with us about what therapy is and how to find a provider. We thank you for this information. Before I turn it over to Gina for our question and answer segment, I want to share where our listeners can find more resources. So on this slide, you will see that AAPI New Jersey has a mental health directory. There's information about AAPI mental health providers in New Jersey, free low-cost counseling options, and crisis resources that are available for the community. To access this information, you can go to their website at aapinewjersey.org, navigate to their resources page, and there will be a section under Staying Safe and Well to view the directory and listed services. There's also case management, so if you need help navigating any of these resources or just accessing mental health in general, please scan the QR code on this slide. You can fill out the form with your information, and the AAPI New Jersey social worker will reach out to assist you. Lastly, there is a 988 crisis line. If you are going through a crisis or someone you know is having thoughts of suicide or needs a non-judgmental, compassionate ear, dial 988 on your phone. It's a great resource. A trained professional will be able to pick up, listen to you, support you, and offer mobile crisis unit services if needed. So these are all things we encourage you to take advantage of or reach out to us if you have any questions. And with that said, Gina, I will now hand it over to you and Sweta to answer all of the questions that the community wants to know and barriers that may come up when we talk about mental health within the AAPI community. So thank you.
We are here with Sweta, our longtime friend, collaborator. Sweta, thank you so much for joining me today and giving this information for the AAPI community and anyone else who might find it helpful. So we are just going to dive in a little bit to some of the frequently asked questions that some of the community members might have about finding a mental health provider and navigating the space, because it can be a little bit tricky, a little bit intimidating. So just to start, what would you say to someone who is so anxious about making that first step, making that phone call or an email? How do I get over this anxiety?
Absolutely. Such a good starting question, right? Well, first, I always want to say thank you for having me back. It's awesome to get to be a longtime friend of the API community and the work we're doing in mental health. So I'm so appreciative that everybody continues to value this work and really acknowledge the importance of it. But there's also so much of the you don't know what you don't know. And I think that's what you're bringing to me in these curiosities and questions. Anxiety is just this interesting piece about reaching out to a therapist, because when I think about anxiety, the first thing I think about is uncertainty, right? I don't know what to expect. Because I don't know what to expect, I don't know what to do. So when we want to get over that hump of that anxiety of reaching out to a therapist, it's really a few things, which is, who should I reach out to? Hopefully this webinar is going to be a really great tool for you. If this webinar is something that gives you a starting point, but you need to speak to a couple close friends, or even ChatGPT tends to be our new best friend for this is what's going on at home, what type of therapist should I seek out for myself? You can look at a couple modalities that might be the best fit for you based on what your presenting symptoms are. And then the next step really is, what do I want next? Do I want virtual? Do I want in person? And then seeking out where I am looking for that. When I start to have a couple bullet points for myself, I already feel like I have a bridge to the next step. And when I have that bridge to the next step, my anxiety starts to reduce. That last piece is, I'm scared to say some of those things on the phone because I don't know what they're going to ask me. I want to remind you that you only have to say as much as you want to say, and you really get to lead that first discussion on the phone with a therapist. If you want to start with, I've just noticed I can't sleep and I have some concerns at home, that's a great launch point for you, and you don't have to share more than that. So just really knowing that you're going to guide that conversation and you're going to have control over that conversation can really reduce your anxiety.
That is great information. And just knowing, taking that little bit, just giving that little bit can be such a great starting point, as you mentioned. And I think maybe sometimes people get overwhelmed with this. Oh my gosh, I have to like bear it all in that first phone call. And that can be really scary. But knowing that you don't have to do that.
I actually encourage everyone to remember you don't bear it all in that first conversation. That first conversation, 5, 10, maybe 15 minutes. And in that, you're going to learn if the person has any space, where they're located, what their fee structure looks like. A lot of that information can take 5, 7 minutes right there. So you might spend a good 6, 7 minutes mentioning what you have going on as of recent, what it's been making you feel like. That's where we talk about symptoms. And what you would like to do next. That's where we talk about goals. And it's really that therapist's intention to guide that call for you. So their intention would not be to host a brief therapy session with you on the phone, but to really just understand what is it that I can best support you with next, and to trust that that therapist is going to lead that conversation for you.
Thank you for that insight.
Yeah,
Thank
absolutely.
you. And then we hear a lot of questions about, how do I know if my therapist is a good fit? I always say it's like dating. Sometimes you just gotta like, meet a few people. So what are your tips or insights? Yeah.
Absolutely. I think dating's the best example, because when you use dating as it, you're really thinking about, what is my body feeling right now? And you're tuning more to the nonverbal parts of yourself, right? And saying, did I feel a sense of calm? Did I feel a sense of peace? Did I feel seen? Did I feel heard? And did I feel like myself in the room? Or did I notice myself wanting to guide it a little bit more? The hope is, of course, in that initial consult call, which is something that you're able to do most often. You get a free 15-minute. In that call, you have a sense of how you felt during it. You hang up going, wow, I kind of felt some relief. Or, ooh, I said a few things and I feel like they went in a different direction than me. Most likely what you felt in that consult call is what you're going to feel in the room during your sessions. So I really encourage everyone to use those as a guiding point. However, if you're in session with your therapist and you notice within the first 3 sessions that you're really finding yourself correcting your therapist, having to guide the room for them, you feel like you're sitting more in the driver's seat than your therapist is, or it's really forming more into a space to just vent more than reflect, most likely it is not the best fit for you. Therapy is a resource for you to help create change in thought and behavior and feeling. And if you're not getting those out of the space that you're in, and you're not feeling those moments of ha-ha in the middle of a session or in between, most likely it's not going to come later. And that may just be the style of the therapist, and maybe the modality of the therapist, or it just may be that the two of you are not the best fit for each other. And that is okay, because just like dating, not everyone is going to be the best fit for you.
Yes, thank you for that. I think a lot of people get caught up in that venting versus reflecting.
Absolutely.
And sometimes people think, oh, this is what therapy is supposed to be. It's just a space for me to and be angry and feel my emotions, which is very important. But is there something more that you can gain from?
Absolutely. The intention in therapy, and I often say this, is your therapist is a space to pause. Absolutely, you can spend a few moments venting if you need to start your session or end your session in that way. But the real crux of the work, right, the real meat and potatoes of it, is really noticing that your therapist is able to start tying patterns together. They're able to notice behaviors and systems in which you function within, and how you are functioning within them, and bringing them to your attention, and creating behavioral changes with you in a way that feels cared for and nurtured along the way. If you're not noticing that you're carrying something out of the room with you, most likely those behavioral changes aren't going to come with you either. And that's really the hope that we want you to receive through this work. And we're orchestrating it and guiding it without you having to recognize where that's happening and how that's happening. And that's kind of part of our magic wand that comes into the work, right?
Yeah, that's amazing. Thank you for that response. And I think maybe something that might be helpful for people to think about is a type of modality that they're looking for. There are so many out there. You do a quick Google search and you got CBT, DBT, you have some of the more holistic methods maybe that we'll call it. How do I know which one is good for me? Do I have to try every single one of them? What do you recommend for people who are new or lost in this space?
Absolutely. In terms of therapy modalities, there are so many. And the reality is, you, as someone who's not in this space, you cannot expect yourself to be well versed on all of them. What I will say is there's a drastic difference between spaces that are going to have more time intention sessions for you, meaning there's modalities like CBT, DBT, and other solution focused therapy that will really have you come in and say, we're going to focus on this one specific goal. This is our intention to work with you, and we're going to treat the symptoms around this, and we're going to help you create some behavioral changes through it. Then there's other modalities that are really going to say to you, what I'm hearing from you is that you have this history of feeling anxious and you're not so sure why or what. And so we really want to get a root cause with you. Part of getting to root cause means that we really have to sit there and understand and unpack with you. It's about where you are in that moment and what you need in that moment and the level of urgency you may have. That 15-minute call that you're going to make for the first time is ideally going to help you know what you need based on the therapist saying, what I'm hearing from you today is X, Y, or Z, and what I would suggest to you is this modality. The next piece is really recognizing specialties. So the piece is also, where are we in life and what is it that I need to focus most on? Am I in a transitional phase? Did I just get married? Did I just have a child? Did I just graduate college? And what is it that I need somebody to be able to understand in my life right now? And is that something they can speak the language around? And that's where niche and specialties areas come in. And if you do a Google search, you're able to say, hey, I'm in the postpartum period, postpartum therapist. Hey, I've gone through grief recently, grief therapy. And people will able to say, this is something I specialize in, and this is a language that I can speak with you in the room. And I do think those niche areas are really, really important to recognize if the therapist can do it or not do it, because we cannot do it all.
Thank you for that. I'm thinking specifically about our AAPI community, maybe cultural influences. How do I break up with my therapist if I realize the modality is not right for me, or maybe the therapist is just not a good fit for me? What do I do? What are my steps?
Yeah, absolutely. I love that we started talking about dating and we're moving into the breakup stage. So I love that we're seeing this relationship full circle and the possibility that it's not the best fit. How do I break up? First, I just want to say the opportunity to get to break up with a therapist is an opportunity to stretch your own rubber band and recognize I'm going to do something that's really uncomfortable to do, because I'm going to have an uncomfortable conversation with someone that I don't think I can see again. And that in itself is going to create growth. The second step is really being able to come in and say to that therapist, what I noticed I came in for is that I really wanted to feel a reduction in my anxiety symptoms. I wanted to address why I'm not sleeping. What I'm noticing we're talking about is what happened at work last week. And I'm just really not feeling like what's happening in the room and what I need in my life are aligned with each other. And so what I need right now is probably a different fit, and that could just look like a different therapy model. Based on what I'm sharing with you, would you have any ideas what you would best recommend for me based on what you've understood about me in the last 2 to 3 sessions? That therapist then has the opportunity to create a healthy closing with you, which we don't always get healthy goodbyes. The second thing they can do is be a resource to you, to a bridge to the therapist that may be the best fit for you. So they may say, wow, thank you for sharing that with me. And based on what I've learned about you, I have 2 or 3 colleagues that I'd love to suggest to you. Would you like me to help you get connected? So now you have a healthy handoff. You have the expertise of that therapist sitting in front of you, and you've also just recognized it's okay to say goodbye without hurting or interrupting a relationship. And that's a really wonderful experience to actually get, which we don't always get in dating when we break up.
Right, absolutely. And hopefully a good therapist will be on the same page about that honesty, that transparency.
Absolutely. As a therapist, to have someone come in the room and feel safe enough to say, working with you has been good enough. However, it's not the right fit for me, is such a gift to a therapist, because all we really want is for any client who makes this call or who walks through the door to really feel relief in what they're calling for. And if we are not that person, that is okay. But we are so excited to get to still give you the opportunity to get you connected to who may be the right person for you.
I really appreciate you demystifying this whole process for us and giving us some of that behind the scenes insight, because you can look really intimidating from the other side of it in that client's chair. So I really appreciate that. I do want to shift gears into some of the more nitty-gritty questions for folks who are looking for maybe a specific type of AAPI therapist and they have limited options. So this could be financial, folks who maybe don't have in-network coverage for therapists that they maybe saw their profile online and really want to see, or maybe they want to go in person and don't live in an area where there are a lot of AAPI therapists. So maybe some guidance for community members who who don't have the benefit of living in really enriched mental health kind of environments.
Absolutely. I think you're describing something that just as a whole is a barrier to services that people need and are seeking out and don't always feel like they have access to. And that's just a real roadblock that many of us are talking about. The first part that you talked about sounded like there was a financial barrier, or there could just be another form of resourcing that we could hit a wall on. I would really encourage everybody to recognize there are so many large platforms out there that actually take insurance nationally, and there's a lot of providers listed on there that are not necessarily in-state providers, but that are you're going to have access to because these are national brands out there, and we'll add those to the resource list. And what they've really been able to do is say, because we're this national brand that exists now, we can have anyone come work for us. And because we can have anyone work for us, we now have a larger network of different backgrounds, different ethnicities, different awarenesses that will come forward. And that's a really beautiful piece. But if you're looking for someone within your local community, most likely you might find yourself having to call different practices and say, is sliding scale an option here? Looking into your out-of-network benefits. We have a wonderful out-of-network benefit guide that we're going to be sharing with the AAPI community, because you may find that you have more access to these services than you recognize when your out-of-network benefits are able to cover much more of them. The last thing I would say is I wouldn't see access to an AAPI provider as a barrier to actually getting services, because what that really means is there's a lot of providers out there who may not be part of the AAPI community, who have a rich level of cultural competency of the community and have invested a lot of time and energy in recognizing there's a whole layer of parts that they can understand, that they can speak to, and what they don't know, they're willing to say, I don't know. And it's a really amazing part when you have a provider who's able to meet you where you are, but not make an assumption about where you are. And so I would say if you're ready to get started, I would not want that to be a barrier for anyone, because we can stepping stone to the parts that we need to, and just getting started is the first step.
Is the hardest part, right? And it's good to keep an open mind.
Absolutely.
There could be people might surprise you, or there might be things that surprise you.
And I actually find some members in the AAPI community sometimes say, I don't necessarily want an AAPI provider because I don't know that I want somebody to over-identify with me. Right. And so there's a part of me that wants to be in the room as a blank slate, and I want to be able to let you know what my experience has been, rather than you making an assumption about what my experience has been. And so there's sometimes benefits to not always having a provider who may be from the same community, but that really wants to understand and invest in what you've experienced and what your role in the community has been for yourself.
Absolutely. And that just goes to remind us that therapy is such a personal journey, and there really is no one size fits all approach to finding somebody, making those decisions while you are seeing a mental health provider, and then making those decisions for yourself. It's a really personal journey.
Absolutely, absolutely. And I think when I think about this idea of needing to find somebody who's a part of my community, or the AAPI provider being a barrier to my treatment, as a therapist, so my brain is always thinking clinically, I get curious, is that a level of resistance in the room, right? Is it that if I can't find that person, I can't get myself to the room, rather than if I can find someone who feels good enough for this moment, can that be my beginning to my journey? And it's possible that from there I may recognize I needed something else, and I may find myself bridging to another provider. But I got that first step in, and I was able to start speaking a language that I didn't otherwise speak for myself.
That's a great way to look at it. That's a really meaningful way to look at it, right? Yeah. And I hope that that's a helpful mindset shift for some of the folks who are watching and have struggled with that in the past.
Absolutely, absolutely. It's always kind of holding our own feet to the fire and saying, is this a true barrier, or is this a barrier that I'm utilizing right now? Because there's something really scary about walking into that door for the first time, or there's something really scary about making that call right now.
It is really scary. And so with that, I want to ask, maybe I think the most difficult question that I've heard, and this doesn't, I don't think, go just for APIs, but in general, for folks who have been through the ringer a little bit and done their fair share of therapy and have had really demoralizing experiences and are either turned off from the idea completely or are struggling to be open to it again, what words of encouragement would you have?
Absolutely. Just any time I hear that anyone's had a demoralizing experience in therapy, it's something that kind of breaks my heart, because this is really a space that we go to be vulnerable and to feel safe, and to recognize that doesn't always happen is really unfortunate to hear. However, what I would say to that is, just like anything else that we've gone through that's hard, When we allow ourselves a reparative experience, and sometimes a reparative experience can only happen by trying it again, right? We talked about that vulnerability of dating from earlier. When we go on a bad date, the hope is that we'll try again because we still have that hope for ourselves. It's no different than with a therapist, right? If we had that demoralizing experience and someone was not able to meet me where I am, my hope is that when I share that with the new therapist that I'm going to work with, they're really going to hear that from me, and they're really going to meet me in it and nurture that part of me along the way. And it's possible that I'm going to get a corrective experience, and through that I'm going to recognize there's a lot of hope in this space, and that one person that I saw doesn't make up all of the therapists out there, but we can only have that opportunity if we allow ourselves to try again, and if we allow ourselves to share that story with our new therapist and really allow them to help us heal through it.
Ooh, I'm getting emotional.
You're like, Sweta, am I in therapy right
No, that's a beautiful response. I'm like, oh my god, I'm gonna tear up. Sweta, I'm curious. There's a lot of stigma in the mental health community in general,
Yes.
or with mental health. Some obstacles, I would say. Some people are curious. If I see a mental health provider, do they have to diagnose me with something from the DSM-5? Do I have to be diagnosed in order to continue treatment?
Absolutely. That question connects directly to, am I using insurance or am I not using insurance? In terms of diagnosis, as a clinician, whether or not you're requesting to use your insurance, and I will acknowledge as an out-of-network provider myself, we still provide super bills to all clients. What are super bills? Those are where we add in what coding we use, meaning what type of session we did, 45 minutes, 60-minute, couple. So that's our coding. The second step is ICD codes. ICD codes are what insurance companies request to be able to either reimburse you or not reimburse you for the services rendered. Now, when you're using your insurance, whether you're going in network, which means the therapists themselves are taking insurance and they're billing on your behalf, or you're going out of network and maybe that therapist is giving you a super bill with that coding on it and that diagnosis on it, the only way to get reimbursed from an insurance company is to have a diagnosis. And it has to be a billable diagnosis. It is not ever your job as the client to know what that billable diagnosis is. Most therapists, myself included, will be transparent with you about what we're putting on your super bill. You'll see it on your super bill when you receive it, or you'll see it in any EOB that you receive. However, if you are not using your insurance, you do not need a diagnosis on any of your invoices. The clinician themselves, most likely in the room, is providing a diagnosis for you. And part of why we're doing that is because understanding your symptomology and understanding what you're presenting with is part of how we decide what our treatment plan is for you. However, as a clinician, we should never be keeping that a secret from you. So if I'm seeing something in the room that I'm addressing, I will say to you, what I'm seeing a lot of is generalized anxiety. I'm noticing postpartum mood and anxiety disorders in the room. It sounds like you've experienced X, Y, and Z trauma, and based on the symptomology I am hearing PTSD symptoms, and most likely my treatment modality would be the next step for you. How that translates onto a bill for you is really your decision of whether or not you're going to submit, not submit. If you do go with an in-network provider, they will always have to submit a billable diagnosis on your behalf for you to continue treatment with them. If you're continuing on with super bills and submitting on your own, it's no different. Your insurance company will require a billable diagnosis code for you to continue to be seen, or else they will not allow for your treatment to continue in a billable manner, meaning they will not reimburse you anything. And if you choose to just say, I want the invoice only model, and I really don't want anything placed in any type of EHR or any type of electronic health record system, and I really would prefer privacy on this, you can have that if you're only utilizing invoices and paying privately for the services.
Great. Thank you for that information. And as far as what somebody chooses to, or how I guess they choose to feel about their about any diagnosis, it could just be for logistical purposes for insurance, or it could be more meaningful depending on how that person might choose to pursue
Absolutely.
treatment.
Absolutely.
Perhaps.
I think the question I'm hearing from you is, what if the person that you're working with is feeling some level of reactivity or some level of reaction in general to the diagnosis that you provided them with?
That's a great way to.
And absolutely, when you put a cluster of symptoms together and then you start to name a big scary word attached to it, there is no doubt that client's going to have a reaction into it. And this is whether or not you're moving into the billable space. Your clinician is there to process that reaction with you. If I just put it on a piece of paper and I never have a conversation with you about it, we go back to, is this a safe space or is this not a safe space? If you have found all of these things about me to be true and you did not share them with me, where do I go to process them? And so it is my work to say to you, you've spent 2 or 3 sessions together, and what I'm noticing is X, Y, and Z symptoms. And those would be classified as this. And what that means is I'm going to be doing the following things when I work with you. And I'm probably going to be noticing them a bit more. You might even notice I point them out, or I might pause you in session to reflect on when that happened. I want you to be just as aware as myself of how that shows up in your life for you. But again, it is your clinician's work to hold as much transparency as possible with you, so as much as they know along the way.
That's great. Thank you for that. I know some folks who are kind of branching out from maybe some of the more traditional forms of therapy, as we might know them to be, into some of the more holistic models. I think somatic experiencing is maybe one of these. Yeah. Some folks are wondering, are these legitimate? Do they fall under this category of evidence-based practice? I know that's a big term that comes up a lot in the physical health and the mental health space.
Absolutely.
And am I right for wanting to try out some of these?
Absolutely. It's an amazing question because there's a curiosity of what do I need next? And when I go to find it, is it what I actually need, and am I getting it in the best way possible? And when I think about these modalities that are coming out, I love your example of somatic experiencing. What I think is in the mental health space, we're all evolving. We're recognizing that it's not just one piece that I'm addressing all parts of my system. Somatic experiencing is so much about what do I attune to? What is my nervous system saying to me? What is it that I need next in terms of internally? Is my stomach feeling nervousness? Is my chest feeling tight? Are my hands getting sweaty? And when I need to understand where is that coming from inside of me. And somatic experiencing allows for words to come from feelings. However, the piece that I think really does need to be addressed in these modalities that are coming out, these alternative methods, is who is trained in them? How are they trained in them? How are they using them now? And is it somebody who's accredited and understands how to do this work? And that's really the big piece that we're trying to connect to in our code of ethics is there's so many people who have access to these trainings now, but we don't know that they have the clinical foundation to be able to best assess for what is safest for their clientele. And that is where we really encourage our clients coming to us or anybody in the community who's seeking out services to say, if you want to do other modalities, go for it. If you want to do them adjunctively, go for it. Just know that you really want to ground yourself with somebody who's able to assess for your safety, they're able to assess for your clinical experiences, and they're able to help guide if something is starting to move out of calibration. And that's really something you want to make sure that they're able to name for you. I know as a therapist myself, when clients tell me they want to try an alternative form of therapy, I may say to them, is this somebody that you'd be open to me adjunctively speaking to over the course of our work so I can really assess your symptoms in the room, but you can continue to do that work outside of the room. And so it's always wonderful to pair something together if it's being done in the most ethical form possible. And that's something we hope to help support you with.
Sweta, thank you so much for all of this great information and for joining me today. I just know that this is going to be such crucial information for people who are really trying to start their mental health journey. So I just want to give you a chance to close us out and give a few key takeaways for the AAPI community.
Absolutely. I think if you're here today and you're watching this video, what you're saying is that there's a desire to get started. And I encourage you, just like going to the gym, if today is all you do is walk the treadmill, allow yourself to walk the treadmill. And so what that looks like in the mental health space, if today is the day where you allow yourself to go to Psychology Today and you type in what you're looking for, a grief therapist, a couples therapist, an individual therapist, you put in your zip code and you put in your insurance, and that's as far as you get today, get started. Because what you're really saying is that there's a world in which I don't know yet, and I can only know it if I start to allow myself to come into it. By being here, you're going to learn as much as you can, but the other parts of learning come through doing. And so I encourage everyone to know that it's okay to start it, to change it, to decide to pivot during it, but just getting started is the best first fit for anyone. And it's really modeling in our community that mental health is important, that I'm curious about my mental health, and I'm going to continue to show curiosity about it. And so you cannot make any mistakes when you look for a provider. You cannot make any mistakes the first time you walk into a therapy room. And it's okay if you pivot multiple times. Just showing up is the first step, and showing up is modeling in our community how important it is to pay attention to how I'm doing and what I'm feeling.
Thank you for those words.
Of course,
Thank
of
you.
course. Thank you so much for asking it, because I think we're all so scared to get started, and we don't know what we don't know until we stand in that room for the first time.
It is such a privilege to be sitting here with you right now. I hope that everybody watching will find this information useful. We have other resources for you as well. This is just one of many, but
Yes.
it is such a good one. We are so thankful to Sweta for being here.
Well, thank you so much for having me, as always.
Gina, Sweta, thank you both for this wonderful information and really telling us how to get started. For more information, you can visit those other resources Gina was talking about on the AAPI New Jersey website. You can follow us at AAPI New Jersey. For Therapy Story, we're at Therapy Story Team, or email us for more information at info@aapinewjersey.org. We'd love to hear from you. Thank you and have a great day.